Okay, so tonight we're going to go through a bit of an introduction, which I'll do in a moment. We're then going to talk about the new contractual framework hypertension case finding service, and Alison's going to talk us through that. Bill's then going to talk us around pharmacy quality scheme. We're not going to go through the details, that's all on PS&C, but some of the key points and things that we think are really helpful to know, and then we'll summarise and close. So first of all, an introduction from me. So welcome and thank you for taking the time to come tonight. I've talked about Mentimeter, so I won't go through that again. Want to just kind of outline really the Community Pharmacy West Yorkshire, and that's both the team and also the committee. We're really aware of the challenging time you're facing in community pharmacy at the moment. We know you're facing workforce issues, are really struggling to get staff, including pharmacists. You've got ongoing funding challenges because we haven't had an uplift in funding for 4 years, and we know that impact that's having. You are continuing to do a fantastic job whilst dealing with working through. We are still in the pandemic, and although things have opened up a lot more than they were, it doesn't mean that COVID's gone away, because it certainly hasn't. We know you're facing additional work through displaced patients that can't access care elsewhere, that are coming to community pharmacy because our doors are open and we have been accessible like nobody else throughout the whole pandemic from a healthcare perspective. So, you know, when we think about the pharmacy quality scheme and new services, I'm sure part of you just thinks, yes, it's all this more work. We do need to remember it's also brings in additional funding. The pharmacy quality scheme does improve quality, and that's the future that the NHS has been very clear. They want us to use our clinical skills more. So I know it's a really challenging time, and I know it probably feels this is not a good time to be getting pharmacy quality scheme or the new services. And that's partly why we want to hear from you today. So if you've got things to add as we go through the presentations, nuggets to share that have really helped you, please do, because we know that you, despite all this pressures, are still delivering your core services and are adding these new services in. Going back to the pressures though, so we do have a pressure service. You'll see a snapshot on the screen of our website, and if you go to the blue toolbar that you'll see when you log on, it's third belongs wellbeing. Really worth a look. So we've got the pressure survey, and we keep that open. So if you are facing any issues, if you've got anything you want to report to us, impacts it's having on patients, impacts having on you, please do that. It doesn't take long to do, and we do look at it, and we do use that in our negotiations and discussions with the NHS, both within places like Calder and Kirklees and also across the whole of West Yorkshire, and indeed reviews that survey feedback into PS&C as well for them to use. So a really helpful way of you telling us quite quickly what is your current issues. And there is wellbeing support available there. You know, the phrase is okay not to be okay. It is really tough. You continue to pull out the bag. You do need to think about your own mental health and well-being. There is free and confidential advice and support available to pharmacy teams. And it isn't just advice around reading a website, it is actually you can speak to people. It's provided through the integrated care system, the ICS. I say it is absolutely free. The link is on our website, but I'm going to just play you this a short video, which I believe I'm going to have to stop sharing and reshare to get you to play again. But I think it's worth our watching for 2 minutes. Can we all see? Can somebody give me from the team tell me if you can see that, please?
Yes.
Thanks, Amanda.
The past year has been challenging, especially for staff who work in health and care services, care homes, emergency services, and our far-reaching voluntary and community sector. The impact of COVID-19, global and personal uncertainty, changes to routine and environment, and prolonged periods of stress is putting extraordinary strain on our ability to cope. We know it's not always easy to seek support, but at this time, it's more important than ever for you to look after your well-being and for organisations to focus on compassionate leadership and a positive well-being culture. In recognition of this, West Yorkshire and Harrogate Health and Care Partnership has launched a new, free, confidential staff mental health and wellbeing hub that's open to anyone who works in our partner organisations. It's only for staff, as we know that you need to be able to talk to people who understand the special circumstances and unique environment in which you work. The Hub offers a range of support services for people experiencing symptoms of stress, burnout, trauma, moral injury, anxiety, grief, and loss. These services include one-to-one counselling and psychological therapies, self-help resources, and information for team leaders. All services are confidential and free of charge. The Hub builds on existing wellbeing support offers that are available where you work and provides an option for staff who wish to access mental health support without going through their own workplace. To get help, call 0808 196 3833, free between 8 AM to 8 PM every day, or visit our website at workforce.wyhpartnership.co.uk.
Okay, so I hope that was helpful. Slides are back, hopefully. So I'm now going to try.
You're sharing your split screen there, Ruth.
No, okay, interesting. Wasn't doing that earlier. Let's share the other one then. Thank you, Phil. So I'm now going to try sharing a Mentimeter app. And so with Mentimeter, we can do several things, including making a word cloud. So let me see if I can get that to work. Fortunately, here we go. So if you go to menti.com, which hopefully you've downloaded, and use the code that's there, I'd be really interested to hear from you. One word which best describes your day-to-day in your pharmacy last week. Day-to-day life in your pharmacy last week. I'll give everybody a couple of minutes to do that and see what happens. And this is part of us listening and understanding, and I think the context, understanding the context of what you're working in. Can you guys see the Menti on the screen? I'm assuming your pictures are changing. Somebody let me know if it's not, please.
They are changing, yes, Ruth.
Thank you, Alison. That's some really helpful insight, and it's good to know you're not on your own with feeling like that. So do remember that work, that wellbeing offer, and also let us know your specifics, so that we are, we can support you in helping to try and look for solutions to those. So thank you. Right, so I'm now going to hand over to Alison, who's going to run through with you an overview of the hypertension case finding. Alison, over to you. You just need to let me know when you want your next slide.
Yeah, that's great. Thank you. Good evening, everybody. I'm Alison Hemsworth, and for those of you that knew Melissa, I've taken over from Melissa after she's left. So I'm just going to give you a quick run through the hypertension case finding service. Next slide, please, Ruth. So a couple of poll questions here for you. So first of all, have you signed up for this service? I don't know how we tell people how to answer the poll, Ruth. So can you give me some advice on that?
Let me see if I can relaunch the poll, because it seems to already be there.
Okay. There we go. So have you signed up for the hypertension service? Yeah, some choices there. And have you signed, if you have signed up, when do you plan to start? And again, some choices. So if you can fill those out before the clock's counted down, please.
Right, shall I end the poll now, Alison, for you?
Yes, please. Thank you. So it looks like most of you haven't yet signed up for the service, so hopefully we'll help you to do that by the end of this evening, and you will feel more able and more ready to do so. I don't. Are there? It says there are 4 questions. Are there some more on a further down the slide, Ruth?
Can you see them moving, Alison? Because I've scrolled them.
No.
So I'll give you a summary because I can see them. So
Okay.
if you have signed up, when do you plan to start? 8% have already signed up, 8% December 21, 38% in January 22. So most people plan to do it January 22, actually 31% March 22. So some people thinking they'll wait till March. And 15% don't plan to provide the service. Most people, 92%, haven't delivered the service, but we do have 8% who've done it to deliver the service to 1 or 2 patients. And 69% of people have read the service specification, which probably reflects the number of people that are planning to go live in that timescale.
Okay, great. So broadly speaking, most of you haven't signed up, and those that haven't yet started, I think is probably a fair summary there. So can we get, oh, that's it. So can you see my slide now? Yeah, excellent. So this slide just gives you a little bit of the background as to why the hypertension service has been commissioned. I don't need to tell you as pharmacy teams that cardiovascular disease is one of the leading causes of premature death in England, hence the reason why it's one of the objectives in the NHS long-term plan. It affects 7 million people and accounts for 1.6 million disability adjusted life years. However, somewhere in the region of 5.5 million people have undiagnosed hypertension in England. So that's a significant number. It's a key driver for health inequalities and counts for around 25% of the life expectancy gap. And therefore early detection is vital, which hopefully this is what this service is going to aim to try and help. And the pilot that was put behind this service demonstrates that community pharmacy can provide a key role in detection and the subsequent treatment of hypertension. Next slide, please, Ruth. So this is the policy context. So you'll all have heard of the NHS long-term plan, and that there's a commitment to the community pharmacy to work alongside others in the primary care team to provide opportunities for the public to check in on their health through tests for high BP. It's centred around NICE guideline NG 136. It includes ambulatory blood pressure monitoring, as that's the clinically preferred method for diagnosing hypertension, and it's part of the 5-year community pharmacy contractual framework agreements to test that we would test it. They've tested the model, and now that it's been tested, it's being put into place. So pilot happened last year, and it was successful, so the service is now being rolled out. Next slide, please. So poll question here: have you read the service specification? I don't know, that will come up again, Ruth, please. Here we go. That's the wrong question.
Apologies, Alison, that there isn't that service spec question was in the last lot of questions.
Oh, was it? Right, okay, fine, not to worry.
Did it?
Okay, not to worry. So if we can we end that one and then we go on to the next slide? So it's an advanced service, so it's an opt-in service, as you all know. It commenced on the 1st of October. Oops, sorry, can you go back a slide? And that was to align it with a similar requirement in the PCN-DES for GP practices to start to focus on hypertension case finding. The service itself has 2 stages. One is to identify the people at risk of hypertension, which is the clinic check. The traditional cuff around the arm. And stage 2, if you identify people at that point with high blood pressure, to ask them to take part in a 24-hour ambulatory blood pressure monitoring in the home. You must be able to provide both stages of the service. It's not a one or the other, it's both. And currently it can only be provided by pharmacists, although PSNC are trying to make it happen so that other members of the team can provide that. PSNC have got a plethora of FAQs on their website should you have any questions. Next slide, please, Ruth. So if you've looked at the service specification, you would have seen this slide already that's in there. Not going to go through it because it's quite small, but this is the pathway. It's a very comprehensive pathway, but this is the pathway to follow once you do start providing the service. Next slide, please. So this is the poll that's Ruth started previously. So there is a briefing. There is a briefing that PSNC have produced for GP practice teams. We as PSNC have started to share that with heads of medicine management for them to share with the GP practices. But if you are having conversations with your GP practice teams about this service, then that's either you can share it with them or you can use it as a bit of an aid memoir to help you with any conversations. But it will be really interesting to know whether you need any other tools to help you with your discussions with GPs. Sarah will answer your question at the end, if that's all right, about 24-hour BP monitoring, ambulatory monitors.
Alison, do you want me to share the poll about PSNC briefing? Or...
Yes, if you can, please. Yeah, just so we get a brief idea that people understand it or have seen it.
And if anybody does think of any resources that that they think I'm missing, if you could put that in the chat. Unfortunately, these polls don't allow free text, so if you put it in the chat, that would be helpful for us to capture. Thank you.
Okay, so it's looking like most of you weren't aware of the briefing. We can share that in a link with the participants tomorrow, if that would be helpful. At least one of you has used it, which is brilliant. Well done. And some of you are aware of it and plan to use it, but haven't done so yet. So, as I say, we can make sure that you're aware of that link. I think it has been in a newsletter, but we can reiterate that message after this evening. Thanks, Ruth. So in terms of what Community Pharmacy West Yorkshire have been doing to help implement this service, so we've written ourselves a work plan to work to over the next 12 months, and the sub-bullet points there are a flavour of what's in that work plan. So I have been linking with Leeds CCG in particular, because they have a CVD strategy group and a hypertension task and finish group. More than happy to meet with similar groups in the other places within West Yorkshire, but that's the only one we've been invited to so far. And what I'm going to start doing with them, they have shared their hypertension prevalence data with me. And once I start to get sight of who has signed up to the service and understand where there might be some gaps, I can use the prevalence data to work out where it's most likely that we need that service, and then start to talk to those of you who haven't yet signed up about all the good reasons why you should sign up to this service. And I've started presenting a few of the AHSN CBD management and primary care events so that GPs and their staff are aware of this service and how it will interact with similar services that they're providing. Next slide, please, Ruth. So over to you if you have any questions, if you want to pop them in the chat bar. We have got some pre-prepared questions if you are too shy, don't want to ask, haven't got any. So I can see one from Sarah that says that you need to get a 24-hour monitor and you're struggling to get hold of them. We have heard that a few people are struggling to get hold of them. I personally haven't got any suggestions about how you go about that, but if anybody else that's on the call has got some suggestions because they've gone through that and have been able to source one, I think Sarah would probably value your comments in the chat bar if you can, please. Shall we just flick through some of the questions that's PSNC have on their website to give people a flavour of what's there?
Yeah, so the 24-hour monitoring, we are aware that, that people are struggling. If you're a member of something like the NPA, that could be a good place to go. We think it's just the demand. It's not just West Yorkshire either. It's demand because of the new service. But yes, we know we go through NPA or some other kind of buying group might be something to think about.
Great. So let's have a look at some of these questions. So PSNC have broken their FAQs down into pretty much similar themes that I spoke about this evening. But I thought one of the key questions that some people might ask or be unsure about is whether atrial fibrillation detection is part of this hypertension case finding service, and the answer is no. So, you know, if you do detect atrial fibrillation, it's not part of the service. However, you may wish to flag that to the GP when you do send results back, but you aren't being paid to detect atrial fibrillation. And currently, it is only qualified pharmacists who can provide this service, not other members of the team, including trainee pharmacists. Next slide, please, Ruth. A lot of these questions are about consultation rooms. The service does need to be provided in a consultation room. So if you haven't got one, then you can't provide the service. However, if you've got access, so for example, if you're a pharmacy that's co-located with a GP practice and you've got access to a room that meets the requirements of the service, then you can then provide the service. And you should also be able to make sure that in that room, patients can put their arm to rest on a table at the right height, and make sure that you've got relevant IT equipment accessible so that you can record results as you're working and speaking with the patient. Next slide, please. We've talked about BP monitors, but they have been the ones that are in the service specification, the ones that have been recommended by NICE. If you've got one that's recommended by NICE, but it's not validated by the British and Irish Hypertension Society, then unfortunately you can't use it, and you will need to source one that has been validated in that way. We are aware that the service specification does still say draft on it. That is because NHS England is still waiting for it to go through its sign-up process, but it is the final specification and therefore you can work to it. I don't know if that's the last slide or whether there's another one to come. Okay, it's another one. So if a GP practice wishes to refer patients to you from patients who have already been diagnosed with hypertension, they can do that, but you have to make sure that you've had the relevant conversations with them. They've had the relevant conversations with you so that you know that those services those patients are coming your way. So it's down to you to decide which patients you will help the GPs out with through a collaborative conversation. And again, you can provide the service off-site, providing the room that the conversation is taking place in can't be overheard by other people, etc., etc. Next slide, if there is one, please, Ruth. If the patient doesn't complete the 24-hour ABPM check for any reason, or because it's fallen off, or they can't tolerate it, and the customer declines another check, you can still claim for that service. So that you don't be concerned that you've loaned the meter out and then you're not going to get paid for doing so. You can claim for it if they have taken that meter away. If you need to temporarily switch off the service because you've got a heavy workload, or you can't get a pharmacist, for example, for a few hours, then you need to make sure that you adjust the DOS in a timely manner so that patients that particular GPs are going to be referring to your pharmacy. And if you wish to withdraw from the service on a permanent basis, then from memory of the service specification, it says you need to give a month's notice. I think that's the last one. Yes, thank you.
It is, thanks Alison, thank you for that. So before we move on to pharmacy quality scheme, does anybody have any other questions that they can think of for Alison? Or it was interesting to see that quite a few of you were planning to start in January or March. It would be really helpful if either you come off a speaker and talk to us or put it into the chat. Do you feel ready for that? What do you need to help you get ready? So what's your barriers?
Hi Ruth, I think the PQS work is a big barrier for us.
So you've possibly got the resources you need apart from the the £1,000 plus VAT to buy the monitor itself. So you feel you've got the resources, but it's just a time at the moment and the conflicting priorities, Amanda, is that right?
Yeah, we just haven't got time to start developing new services when we've got all the other work to do plus Christmas and everything as well.
Thank you for sharing, Amanda. Given the time, I'm going to now move on to Phil, but if you've got things, please just put them in as you think about it in the chat. We can pick them up at the end. So Alison, is there anything else you'd like to add before I hand over to Phil?
No, thank you.
No, thank you very much. So Phil, over to you and Pharmacy Quality Scheme.
Thank you. Good evening, everybody. I recognise quite a few names on the guest list today, so I think some of you will know me. Those that don't, my main role is PCN support, so I look after, hopefully support the PCN leads in the work that they do at the primary care networks. And I also look after contractor support for Community Pharmacy West Yorkshire, so some of you may have come across me maybe asking questions or answering questions you may have. So if we just move on to the first slide, please, Ruth. So yes, I've been asked to talk about Pharmacy Quality Scheme. I'm not going to go into huge amounts of details about all the domains and what have you, but I've just tried to pick out a few things. Maybe you have seen, maybe you have noticed, but just things that I think are worth just mentioning here. So as in previous years, there is two parts to the Pharmacy Quality Scheme. There's a gateway criteria, which are the minimum requirements that every pharmacy has to do in order to qualify for claiming payments under the domains. So the gateway criteria this year are slightly different to previous years, or rather there's a significant addition, which is for every pharmacy to complete 20 new medicine services before, I think it's from April up until the 5th of January next year. So most of you, I think, have been doing that or are doing that or are well on the way to do that. If you perhaps haven't looked into that, we have sent out an email recently from the Community Pharmacy West Yorkshire web's email address, giving you some advice and some links and things that might be able to help. But if anybody wants specific help, they're quite welcome to get in touch with me. So that's the first part of the gateway criteria. There's also a training requirement and reporting. So the CPPE lookalike, sound-alike e-learning, you might be required to demonstrate some learnings from that, and also to carry out a safety risk review. Having done those things, you'll then be able to move on to the domains. There's 6 domains this year. I think there were 6 last year, but I'm not 100% certain of that. The final day for completing the work around those domains is the 25th of February next year, which is the end of the declaration period. So which opens at the beginning of February. And so in theory, you've got until then to do everything, but obviously the sooner you get into this work, the easier it is and the less time consuming it will be at the end. The only domain that has a slightly different timescale on is the PCN domain, which relates to flu vaccination service, and all the work relating to that needs to be finished before the end of December. If you haven't already done so, your PCN, if you haven't already seen it rather, your PCN lead will have sent out a survey asking for what provisions you're making for flu, what your plans are for flu. If you haven't completed that and send it back, that's the first stage in that PCN domain. Once your PCN lead has that information from you, they'll be arranging to speak to the clinical director and discuss what collaboration is possible between GP practices and pharmacies, and then between pharmacies. And they'll be rounding things off with a Zoom meeting, which all contractors need to attend. And those two are the 2 key elements really in your evidence gathering for completion of that domain. The final piece in the jigsaw is the completed flu plan, which again, your PCN lead will be aiming to email to you before the end of December. So For them to do that, they need you to complete the survey and take that step and get it back to them, and then reply to emails that they might have about the Zoom meeting, making sure you're all available. Could we move on to the next slide? What's it worth? Why is it worth doing the PQS? For an average pharmacy, which we've taken to be in that sort of 60,000 to 150,000 items a year, the minimum value, if you complete all of the domains, is £6,775. But depending on how many contractors actually complete the domains, the pot of money can then be divided up. So it could be worth up to a maximum of £13,550, depending on how much money there is to share between the contractors who complete the work. So it's not insignificant. Yes, there is quite a lot of work in those domains, a lot of training, which is worth getting into early on. One of the key messages that we want to get across, there's a lot of things in this year's PQS that were in last year's, and once you've done them, you don't have to do them again. So the sooner you get into the work and complete things like some of the training, staff don't have to do the training every year, you don't have to do the training every year. You've probably got half PQS done. If you do it this year, you'll have half of next year's done, would be my guess. Can we move on to the next slide, please? So there are other resources. So obviously what we've done is split this into what's the role of PSNC in supporting contractors and what's the role of Community Pharmacy West Yorkshire. And what we try to remind people all the time is that the full information is available via the PSNC website. And if you go to the Services Commission page or just search for Pharmacy Quality Scheme, you'll find all the information there about the domains and exactly what you need to do. I think it was a couple of weeks ago now, maybe last week, if my memory is not quite right, but the PSNC sent out a PQS Action and Evidence Portfolio Workbook, and I had a quick look at that, and it's really quite good in the way it sort of leads you through. Have you done this? Tick the box, yes, and it helps you to gather all the evidence you need together and quickly identify where you might have some gaps in training or in some of the surveys, etc., that you need to collect information on. Could we move on to the next one? So if you do go to the PSNC website, hopefully most of you will have done this, but basically this is what you'll see. And as you can see there, each of the domains are listed, the gateway criteria is there. You can expand those to see the details behind them. And then the next slide, please. So I just expanded one of those that I thought was particularly worth looking at, which is the guidance and resources and web pages. So there's a lot of useful information, useful templates there. There's training records. There's sort of moving on to the next slide. There's templates really to help you gather the right information. So it's a bit small on my screen, but this is a data collection form. So this covers, I think there's more than this page that you can see here, but it covers more than one of the domains. So it's something you can have either in dispensary, on the counter, wherever is most appropriate, where you can record the number of patients that you've had interactions with about different parts of the service within PQS. So you can quickly keep a record there of whether you've spoken to patients about weight management, etc. And then the next slide, which again I thought was particularly useful to know about, was relating to the oral anticoagulation safety audit. So again, there's more to it than this, but there is a template there that you can use rather than trying to create your own, which hopefully when you're doing consultations, you can quickly work through. You can quickly work through that and keep the records that you need. So next slide, please. So what are Community Pharmacy West Yorkshire doing? So we're trying very hard, resisting all my urges sometimes, to not duplicate what PSNC are already putting out there through their newsletter or through press releases, etc. So what we're trying to do is stick to bringing you information about local information that you need to know. So for example, we've recently put onto the CPWY website details of the tier 2 weight management services that are available through each of the CCGs. So if you go to our website and look at the Pharmacy Quality Scheme page, you'll see those links there. Yeah, we're obviously part of my role as well is I'm perhaps putting a little bit more effort into trying to support the PCN leads to do the work that they need to do as part of the flu vaccination collaboration for the PCN domain. And the other main task that we've sort of set ourselves is to alert you to the impending deadlines. So we've had one that's passed recently, which was the aspiration payment. The next deadline will probably be reminding people as we go through December about the PCN domain, urging you to sort of comply with any requests from your PCN lead. But then, as I said, when we move beyond Christmas and into the new year, we'll start reminding you about the actual claim window, which, as I mentioned before, runs through February. Next slide, please. And one last bit of information, again, just making you aware, really. This came through again, I think last week or the week before, virtual outcomes. So if you, recognising the time pressures everybody has, you might like to try this instead, which are a series of short videos. So if you go into virtual outcomes, as you can see there, there's the pharmacy quality scheme. If you expand that, click on that button and expand it, it will show you short videos about each of the domains, which hopefully gives you a sort of encapsulated summary of what you need to know to get started on that domain, and hopefully answers a few questions there as well. Next. So again, we'd like to get a little bit of your feedback about how things are going, working. So we have another poll which we'd like you to complete. It's just popped up on the screen now. So if you wouldn't mind filling that out, that would be great. So I think looking at that first bit, as we'd probably expect, with nobody so far has actually completed the work, but I guess that's expected. But I think most people have got plans in place or they've already started. Just one person really not thought about PQS so far. So my advice there is, you know, do look at the PSNC website. It looks more complicated than it is, and there is a things to start, which basically tells you what the training requirements are, so you can get started on those, because that's the most time-consuming part of it. A lot of the other bits of PQS you're probably already doing. Have you used any of the PCN resources? So yeah, people are using those. So that's good. That message is getting through from PSNC, so that's good to see. And I think everybody's at least aware that those resources are there. Main barriers. So what are the main barriers that hinder progress? So I think, as we're all acknowledging, pharmacy workload at the moment, particularly with the perhaps the flu domain and the training. Flu vaccinations are taking up a lot of people's time at the moment, apart from all the other pressures that are still out there. I think everybody seems to think we've got enough information about PQS, so that's probably a good decision for us not to duplicate the stuff that was already coming out from PSNC. A few people think it's too much work for the rewards. So I think I've return to my comment there about, if once you've done it once, it will help you in future years. So biting the bullet at some point to get that work done will stand you in good stead for future years. And I think we can be fairly certain, in fact, we can be certain that there's going to be a PQS 22, 23 and probably 23, 24 as well. Some staff shortages there as well. That does seem to be a problem for quite a few people. And again, we are aware of it. I guess there's not a lot we can do to help you with that other than empathise, I think. Okay, so thank you for that. That's very useful feedback.
Can I just give feedback about the workforce issue? So yeah, we absolutely do empathise, and we unfortunately don't have a magic bag of workforce to help you. However, we are challenging workforce groups both in West Yorkshire and nationally about how they look to help, help provide some solutions and look at some longer term solutions for the problem. So the data you've given us on that the pressure survey has been really, really helpful in us having impactful conversations around how we help support community pharmacy workforce. So it is something we're trying to take forward, but it is not going to be a quick solution. So I do apologise for that.
Thank you. Next slide, please. So opportunity for questions. Does anybody have any burning questions? Anything we can help with at the moment? By all means, shout out or put it in the chat, or raise your hand if that's how you'd like to do it. Nope. Well, in Blue Peter fashion, here's one I prepared earlier. So if we move on to the next slide. There are some very good, there's a Q&A, sorry, a FAQ section on the PSNC website. And to be honest, it probably does cover everything that people might have. But as we've already discussed, will there be a PQS for 22-23? Yes, there will. I'm just reading a comment. Sorry, a comment in the chat there.
I'll read it out for you, Phil. So you
yeah, thank you.
So it's from Samia. PCN lead-wise, how do we claim for payments previously to COVID? We could claim for meetings held. I think that's one that, Phil, will you pick up outside the meeting?
I think that, yes, there are ways to do that, Samai. So yeah, let's have a chat tomorrow about that if you're around. Yes.
Camille's question is, are there any safeguards if the patient doesn't return to the ambulatory blood pressure monitor device? One for you, Alison.
Yes, there is an answer to that on the PSNC website. I haven't got it to hand, but it's definitely there because I remember seeing it when I looked at it this morning. So there's definitely information about that on their website.
If we get a chance to do it, we'll try and put the question.
Yeah, I'll look for it now. Yeah.
But, from what I remember, it's a risk, and I know it happens in general practice, and there's not, I think there is things about how you can have that conversation with patients. Samaya. Oh, that's it.
Thank you. Yeah, so thinking about NMS. So yes, the NMS provision the catch-up NMS, which relates to the inhalers that have been issued during the COVID period, where people probably haven't had NMS to support those. So yes, they can count towards the 20 NMS for your gateway criteria. Looks like there's a few more questions coming through in the chat now.
So one around NMS data from the BSA, I can't see who it's come from. Raf, I'm assuming the deadline is the end of December 2021. Do you know off the top of your head, Phil, when they're counting
to do the 20? It's up to the 5th of January. So
there you go. Amanda's just, I never know, there's a loan agreement you can use with patients to try and get some commitment, and they're going to return the ambulatory monitor to you, but you can't ask them for money as a deposit. From Catherine, are there any audits on the PCN work, i.e. how long will we have to archive the completed PQS for, and who can request to see it?
So not specifically for the PCN, but for PQS, I'm not sure how long you would have to keep it, but yes, it can be checked and verified. So I think you could probably be asked to submit that rather than somebody come in and actually see it. I would imagine you'd need to keep it until you've been paid at least.
Yeah, I might want to check this in FAQ on that, Phil, and we'll share that if we see this in FAQ. Raf Med's comments that actually the 5th of January figures, they won't know on the FP34 whether they're submitted for the 5th of January and the 6th of January because the way that it works. So that's probably a really good thing to bear in mind. what we've been doing is we know which contractors who haven't, looking at the data we've got, there's always that lag, who haven't achieved, and we've been directly discussing with them that have they got to 20. So our, I think the advice would be get to your 20 well before the end, December, so that you're going to qualify.
And we are basing our assumptions on data for September at the moment. So yes, there is that lag that people may have completed NMS that we don't know about. But yeah, we're just trying to help and support.
Alison, would you like to give an update on your response you put in the chat around the monitors?
Yes. So the PSNC's recommendation is that to reduce the risk of expense associated with having to replace lost or damaged devices, contractors are recommended to explore obtaining insurance for devices taken away from the pharmacy. This may be available by insurance providers or trade organisations. So hopefully that helps you, Khalil. And anybody else that was wondering.
Okay, so the next question I'd sort of pulled out of the FAQs there around PQS was relating to the training. We've sort of covered that already. So do you have to repeat training if it's already been done, the e-assessments? No, you don't. If staff or pharmacists or any personnel in the pharmacy have already done those, that's fine. They'll count for this year, they'll count for next year.
I think there was an update to one of the inhaler ones, wasn't there, Phil, where they've got to do the most up-to-date one. So that's the only one where you might need to repeat it.
That's possibly the only one that people wouldn't have done before. Yeah, I mean, what we're finding with PQS is a number of the domains don't change each year. So the medicine safety, for example, that hasn't changed. So with those having done the training, there will be new training each year as new domains are changed or introduced. But yes, thanks for that, Alison. So next slide, please.
I think what's worth bearing in mind as well is, as you said, Phil, it seems some things kind of go into PQS as a domain, and they sometimes lurk themselves into a gateway, and then they seem to find their way into the terms of service. So we actually have to do them as a terms of service. Could have a whole big discussion and debate about that. But going back to your comment, if you can do PQS as soon as, if you keep doing PQS, at least you get the money for them while there's money in the system to be paying for them.
So a question here about pharmacy professionals within the pharmacy, and does that include locums? Yes, it does include locums that need to complete training. Declaration period there, we have discussed that already. So it starts essentially actually on the 31st of January rather than the 1st of February, but goes through until just about midnight on the 25th of February. Don't miss that. It's worth, when you do submit, you should get confirmation that your submission has gone through. I think that comes as an email, I think, Ruth, or we've certainly seen email confirmations. So do look for that, because sometimes if you've not completed one of the sections or not fully answered something, then you may appear to have completed your submission, but it may not actually go through. When will I be paid? Well, the payments are due to be paid on the 1st of January 2022. For those of you who did the claim for the aspiration payment, there'll be adjustment for that. So was that to me, Ruth? You, not us, or no? Okay, sorry, good.
Great spelling, my typing error.
All right, sorry, good. I think that might be the last slide, unless there's another one there. Any more questions that anybody's got around PQS or anything else we've talked about? I think there's another question about blood pressure monitors. Or was that an answer?
Alison, you're muted.
Sorry about that. Yeah, Sarah, the answer to your question about can you just use an ordinary clinic monitor in the patient's home? No, they've made it very clear you must use an ABPM And PSNC's answer is, if a patient's practice requires a patient to monitor their blood pressure over a period of 7 days, can we provide the clinic check part of the service to support the patient? And it says no, such checks are not within the scope of the service. So hopefully that helps to elaborate on your answer, on your question as well.
So if that was the last of the questions, they're just showing my email address up there, pcnsupport@cpwy.org. Really pleased to hear from anybody with any questions or anything I can help with. Happy to do that. Thank you, Ruth. I'll hand back to you.
Thank you very much, Phil, and thank you, Alison, as well. So it's really difficult to know what to put in these events. So we will be sending you an event evaluation, and we need you to tell us, what is it, what you wanted, what do you want? Because if you tell us what topics you think are going to find useful, things that you want to hear from us, we're really happy to try and provide those for you. But thank you very much, because I'm sure you've all had really busy, challenging days. It's busy, you've still got flu going on. We're starting to kind of cast our eyes towards December and the delight that is in the world of community pharmacy. So thank you very much. And just to be on a positive note, I know things are feeling really challenging. However, we're having some really positive conversations. As Alison says, there is a real will to look at actually how community pharmacy can work together and be integrated into the system, through primary care networks, but also through some of the services that we're offering. We're certainly seeing the community pharmacy pharmacist consultation service ramping up of that. And if we're looking week on week, we're getting more practices sign up to provide in that service. So that is actually really helping your patients. So a big thank you from us, and thank you for tonight. Just this in the chat. Yeah, so thanks Khalil for his comment. More than happy, as I say, if you do feel there's something which you think we could do to help you, do ask, and we will do our best to help support. So I think it just leaves for me to say good night, take care, and look after yourselves. I think it's just us now, guys. Thank you.
Very good.
I'm just going to close stop the recording.